So thank you so much for everyone joining today. I'm so excited to talk to you about this webinar presentation about the fourth trimester of sleep. And this is the Doula's Guide to Newborn and Postpartum Sleep Care. So my name is Kelsey Alford. I am the owner of Nested Sleep. I provide sleep education and one-on-one sleep consulting to both professionals and families. So really excited to talk to you about sleep care today. So just give me a second and I'm going to get a presentation loaded for you guys. Thanks for your patience there. Oh, 1 second. Okay, so as I mentioned, we're going to be talking about mostly newborn and postpartum sleep care. And because a lot of similar issues occur prenatally as postpartum in terms of sleep for moms, we're also going to talk about sleep in pregnancy and how those issues develop during pregnancy and how they can cross over into the postpartum period. Just a disclaimer is that we are not providing any substitute for medical advice here. This is solely for informational purposes only, talking about common early childhood sleep issues unrelated to medical conditions. So you'd always want either yourself or any of your clients to reach out for the advice of a doctor or other qualified healthcare professional in terms of specific medical conditions and concerns. And you always also want to follow your scope of practice for whatever your profession is or whatever type of doula you are. If you have any questions about that, you can find the scope and ethics guidelines on the DONA International's Code of Ethics website here. In terms of our topic guide today, what we're going to cover and what we're going to go over, I'm going to talk about sleep during pregnancy. As we said, a lot of those issues that are developing during pregnancy can cross over. So we really need to know when and how they're developing and what physiological reasons are behind those. So we're going to talk about sleep in pregnancy. And related to that, we're going to talk about fetal sleep. So what that baby is doing in terms of their sleep in utero. Insomnia in pregnancy will be covered, and postpartum insomnia as well. And again, how those two can be intertwined and related. We're going to go over newborn sleep needs in depth and talk about what their needs are, both from a physiological standpoint and also how their overall schedule looks in that newborn time period in terms of their sleep. We're going to go over the newborn circadian rhythm, the development of that, and how they can eventually get on a schedule, but why in the beginning they're not so much on one. So we'll talk about the development of the circadian rhythm. We will go over sleep regressions, both towards the end of the fourth trimester, what typically starts to occur, and then we'll also cover the common sleep regressions that will occur within the first year or so of life, so you can provide some anticipatory guidance to your clients about what to expect. We will go over changes in sleep patterns during the first year of life and how that changes from the newborn time period into infancy and what to expect in terms of their patterns of sleep. So we'll go over their typical nap schedules that they'll start to set in place towards the end of the fourth trimester, and also nap patterns and overnight sleep patterns that'll happen during that first year. And then we'll end talking about sleep support and what that can look like for the doula, especially the postpartum doula. How can you provide support for your clients, both emotionally and physically? So we'll end talking about that. And then once the webinar is complete, we'll have time for a Q&A. Any specific questions you have around prenatal, newborn, and postpartum sleep. And then I'll also be offering you access to our Facebook page. I'll create a Facebook page specific to this webinar, so you can discuss amongst each other any sleep-related issues regarding to doula care. So let's first start talking about sleep during pregnancy. And on each topic, I'll list certain objectives that we want you to meet, which will then be covered at the quiz at the end and sent to you. So in terms of objectives for sleep during pregnancy, we'll list the top 5 medical sleep concerns that typically occur during pregnancy throughout the different trimesters. And I also want you to understand some different sleep positions, both to try to avoid during late pregnancy, and then also offer you some positions that can be helpful, so you can help clients get into a better sleeping position for overall better comfort and better safety for mom and baby too. Under each topic, you'll also see a bibliography and citations, both on the main page, and then if in relationship to a specific topic, they'll be quoted within the slide too. Okay, so why is sleep during pregnancy important to talk about? According to the American Academy of Sleep Medicine, we know that not sleeping can lead to a number of problems. Expectant mothers who have poor nighttime sleep are more likely to have a depressed mood. They're more likely to have attention and memory problems, exhibit excessive daytime sleepiness, more nighttime falls because they're getting up and just walking around at night and they're already off balance being pregnant, and more use of over-the-counter or prescription sleep aids. These can adversely affect the healthy development of her baby. And a lot of times when we think about sleep in pregnancy, and pregnant moms are often hearing that poor sleep during pregnancy is just something that happens during pregnancy. It's almost like a rite of passage, right? That is not true. That is not the case. You want to have them to have good overall sleep for their mental and physical health, and then also for the babies too. When we talk about sleep during pregnancy and look at the top 5 medical concerns throughout pregnancy, the number 1 is urinary frequency. And I think any of us that have been pregnant know how common this is, both during the daytime, but also at night. And that is about 75% of women will experience that at some point during pregnancy. And for most women, that occurs in most of the trimesters. So in the first trimester, that can happen because of increased hormones that are getting increased blood flow to that bladder. During late pregnancy, urinary frequency is more due to pressure itself on the bladder with the growing baby and growing uterus. So that one can happen in all the trimesters of pregnancy for different reasons. Number 2 is insomnia. And insomnia can happen in about 57% at least of women during pregnancy. And this one, again, is across the board. Usually that first trimester, again, more due to increased progesterone development. And then later in pregnancy, insomnia can be more related to different positional things and also related to anxieties upon the upcoming birth. So we'll talk more about that in a bit. Number 3 is overall GI concerns, gastrointestinal concerns. Again, during that first trimester, this tends to be more nausea. Now, it is a myth that nausea is only morning sickness or only in the morning. Many women exhibit it at night. If you exhibit it at night, sometimes the things that can be helpful are a snack right before bed, but you don't want that nausea to be causing any insomnia related issues or having them keep awake because of that reason. And then during the second and third trimester, more of those GI concerns tend to be heartburn. And this is about 30 to 50% reporting frequent heartburn in those second and third trimesters. The fourth one is restless leg syndrome, happening in about 1/4 of your clients. And restless leg syndrome is best described as a tingly feeling in your legs, Some people describe it as feeling like bugs are kind of crawling on your legs, and it is not a good sensation. It definitely can lead to both trouble falling asleep and trouble staying asleep during the night. And the most common trigger or cause of restless leg syndrome during pregnancy is low iron and folate stores. So you always want to have the mom really looking at her diet. Iron is something that is usually checked at least once during pregnancy by their healthcare provider, but it should be checked more if they're exhibiting symptoms of restless leg syndrome. The fifth cause of sleep concerns during pregnancy is sleep disorder breathing. So sleep disorder breathing, that 19% of women, that encompasses both snoring and encompasses obstructive sleep apnea. Those two things sometimes can be related, and sometimes you can have snoring without obstructive sleep apnea. The thing you want to let women know is that some people think of obstructive sleep apnea as just from the weight gain. That is not the case. Sometimes it is due to increased hormone development that causes your nasal mucosa or inside your nose to be more swollen and inflamed. A lot of women will complain of congestion during pregnancy, and that congestion can cause that snoring overnight. And that can be disruptive for both the new mom and the family as a whole if she has never snored before and dad's now like having insomnia himself. So these are the top 5 medical sleep concerns. There are many, many more out there, but these are the highest percentage when we look at overall numbers. So how can we help those moms, those pregnant moms, kind of not get all of those symptoms and try to ward off some of them happening at all? You can provide them some anticipatory guidance, meaning that you can tell them for that urinary frequency, yes, drink lots of fluids, especially that water, but try to cut down on the amount you're drinking right before bed. So really tank up on those fluids throughout the day so that drive to thirst is not happening all right before you go to bed. Obviously urinating right before sleep. And yes, you're probably going to need to wake during the night, but making it in a safe situation when they are waking during the night. So having a small nightlight in the bathroom for when they do need to get up during the night. So then they're not fully waking when they do need to go to the bathroom. They can just go, come right back to bed, hopefully fall asleep very quickly. You can tell them to avoid that heartburn, to not eat large amounts of spicy, acidic, or fried foods. That's one we all typically hear, but you really want to encourage them to eat small, frequent meals throughout the day. And that can be so helpful to learn during pregnancy because that is such a good skill to have for when you're breastfeeding. So you're going to be wanting to eat small, frequent meals and lots of healthy snacks when you're breastfeeding. So why not start that process when they're pregnant, eating those small, frequent meals and learning what are your healthy options for those small snacks, whether it be just a handful of nuts that they can grab or a small granola bar, some cottage cheese, just thinking of really small meals that provide that protein that can fill them up, but not be causing that heartburn. For any clients that are having those complaints of restless leg syndrome, obviously they should talk with their healthcare provider. Again, it's not something that should just be suffered through because you're pregnant, and they can be evaluated again or for the first time for that iron and folate deficiency. And then if they have had that, their provider may put them on some supplements, may put them on some medications, but you can overall help them look at their diet, try and be healthy, think of the options that they may not think of themselves. A lot of people, when they think of iron, are like, oh yeah, I just need to eat more red meat. Not always the case. There are lots of other different options you can choose to get iron. It can be that green leafy vegetable, the spinach. If they don't like spinach, you can add it into a smoothie. Lentils have a really high amount of iron and some other grains. So you can help them think outside of the box in terms of their nutrition. In terms of if they can't sleep or are having some of those insomnia issues, remind them to don't force yourself to be in the bed. If you can't sleep, After a few minutes, if you can't fall asleep, getting out of bed, having a chair in the room or somewhere quiet in the living room that they could go and read a book or knit or crochet something for the baby, write in a journal, ways to get their mind off of just thinking, oh, I just have to fall asleep. Even taking a warm bath can be helpful. So these are all things that you can help them to kind of fight off some of those insomnia issues. Okay, so let's talk about sleep positions. And this is more specific to the third trimester because that's when most women do start to get pretty uncomfortable and really need to look at different positions to help them sleep and help them get that good blood flow to the baby that they need. We know that based on research, the reduction in supine sleep in late pregnancy can provide maternal and fetal health benefits. Those benefits typically are less desaturation in oxygen, both for mom and baby, when they are not laying on their back. So that's what supine is, laying on your back. So you want to try to have them find this ideal sleep position. So when sleeping, lying on your left side, best sleep position with your knees and hips bent to really reduce that pressure. You can place pillows between the knees and under the abdomen and behind your back. This can take pressure off of your lower back. And some of the different options you can look at here in this picture can show you the different types of pillows that moms can look at in terms of pregnancy pillows. You can consider a wedge, a C-shaped pillow, or a U-shape to again get that pressure off of the lower back, and that can provide more comfort. And the more comfortable they are, the more likely that they're going to sleep on their side. So that's what you want to be providing them. And what better to look at pillows that you can use for many different things, right? So we don't just want the one and done types of things that we have to buy these days. We want to find many different options. So I always tell moms, well, you know, anything like this, like a pillow that you're going to be purchasing for pregnancy, is such a great thing to use for breastfeeding too. And this can be used for, you know, at least a year postpartum. So you think about your pregnancy and your postpartum journey, and depending on your length of breastfeeding time, you know, this could be a really well-used pillow. So it's definitely worth it to make the investment for these pregnancy pillows. Okay, so moving a little bit off, moving on to talk more about fetal sleep. So we're going to describe the percentage of fetal sleep versus wake time, especially in late pregnancy. That's where a lot of the data is. And then we'll understand some of the differences in fetal sleep compared to newborn sleep. So when we talk about the fetal sleep and wake time in late pregnancy, there are some differences in sleep-related brain structure between prenatal and the postnatal period. Even within weeks, this is really amazing research that has been done to show that even at 36 weeks gestation, there's quite a bit of difference in terms of the baby's sleep compared to that postnatal period. So they classify fetal sleep as either quiet sleep or active sleep. And active sleep, that is most similar to REM, rapid eye movement sleep, that is in the postnatal period. And that is when a lot of that development is happening during that REM period or that active sleep period. And so there's a lot of that sleep that's needed, both in utero and then when they're born. Now, a baby that is in utero from 38 to 40 weeks only spends about 5% of its time awake. That is crazy. So when we think about, you know, moms that are worried about the kick counts and everything like that, just obviously following your guidelines of your provider on what they're looking for. But know that in terms of awake time, it's only about 5%, even right towards the end of pregnancy. And then when we compare that to newborn sleep, there's a decrease over time in active sleep as term is approached. So there's a pretty major difference, even from that 38 to 40 weeks is about that 5% of awake time. And then around when they're born, I mean, some are born at that time, and then around when they're born at 40, 41 weeks, they're now about 20% of awake time. And so that is pretty crazy in terms of our sleep development, that our body knowing and the baby's body knowing that, okay, like now that I'm being born, I do need to be awake more because I need to be eating more. And that is a really important thing to remember for those babies that are not quite preterm. That 38 to 40 weeks is usually, within the normal time frame, but they may have a harder time with breastfeeding. It may take them a little more stimulation to get them to attach to the breast. And so to know that and tell moms that, sometimes they're like, oh, I have to wake my baby to eat. Why is that? And sometimes if they're born at that 38 to 40 weeks or even earlier, that can be one reason of many why there are some feeding issues. So to just kind of know that and keep on top of how to help with that. So we're going to talk now about insomnia, both in pregnancy, and then we'll guide into postpartum insomnia as well. We're going to state the percentage of women who experience insomnia in pregnancy, and we're going to learn behavioral techniques to help with insomnia in pregnancy. Insomnia in pregnancy happens in at least about 57% of women. That's pretty high. That means that most women are going to have trouble sleeping. You talk to most new moms and you're like, how are you sleeping? That's kind of a question that's brought up both prenatally and then postnatally as well by really anyone that finds out that you're pregnant. They're like, oh, so sleep's not that good. Oh, are you having crazy nightmares? Oh, are you, getting up to pee every 2 seconds? Again, people consider it that rite of passage. It's not. You need to help them with these sleep issues. So why is insomnia so important to treat? Well, it is a major risk factor for postpartum depression and other postpartum mood disorders. So another thing that is important in addition to that risk factor is that this was great research that has been done. Women who sleep fewer than 6 hours per night had longer labors and were 4.5 times more likely to have a C-section. That is huge. So, that can be due to so many different factors that were not all described in this one particular study. But that means that sleep is really important to help these clients be getting good sleep. And a lot of women think that, especially if they were busy workers before they got pregnant, maybe they didn't value sleep. Maybe they were only sleeping 6 hours a night. Plenty of Americans are due to, work demands or what have you. And so for them to really focus on needing at least that 7 to 8 hours of sleep, and many women during pregnancy having so many more demands on their body that they need even more sleep than that. I remember throughout my pregnancy, I would sometimes be sleeping like 9-10 hours. That was for my first pregnancy. My second pregnancy, dealing with a toddler, was not able to get that. But for those new moms, this is a great time to really have a lot of self-care and listen to what your body needs. And it often is going to need, again, at least that 7 to 8 hours, if not more. So when we talk about prevention of insomnia in pregnancy, what are some things you can do to help the clients have less insomnia overall? We talked about the use of some dim night lights in the bathroom. That can make it helpful because you're not having that bright light stimulation in the middle of the night. A lot of women, in terms of naps, now if you're going to take a nap, I always say, remember to take a nap and not a sleep. So if a nap is more than about 30 minutes, then you're going into a deeper stage of sleep. One, it's not going to be as restful, and two, it'll start to mess a little bit with your circadian rhythm and make it harder for you to fall asleep at night, especially if the nap is like afternoon or evening time. So you really want to try and limit those naps, especially if you're having insomnia. If you're not having any insomnia issues and you get home from work or the client gets home from work and they need to take a quick rest, again, just try and have it be on the shorter end of things to not mess with their overall rhythm. As long as clients are medically cleared, they should be exercising, and appropriate exercise 30 minutes a day if they can. And exercise can really help a lot with falling asleep. The only real guideline is to say, and this is for all, not specific to pregnant women, really not exercising within an hour before bedtime. The reason for that is that when you exercise, you're increasing your heart rate, you're increasing your body temperature, and those things make it harder to fall asleep. That's why they say to, keeping your overall sleep environment a little bit cooler. It allows for your body to sleep better over a night in terms of the sleep environment. Again, we talked about if they're not able to fall asleep, to not force the going to sleep, but doing that non-stimulating activity before going to bed. Electronics is a huge one for insomnia. You want to be turning off TV and phone within an hour before bedtime. I actually highly recommend not plugging the phone in right next to the bed, but rather either on a different side of the room. In our family, we have a recharge basket that we have down in the living room. That can be really helpful to get the phone out of the bedroom. This is because that blue light that's emitted from the phone, or any bright light that's emitted from the phone, can mess with your own melatonin production and make it harder for you to fall asleep. You want to avoid stimulants like caffeine use. In pregnancy, the ACOG, the American College of Gynecology, has recommended that you can have some caffeine during pregnancy and it not be harmful to you and the baby. But you don't want to have a lot of caffeine specifically in the afternoon or evening hours. And you still want to limit the amount of caffeine that you are having. So especially if you have insomnia, you really want to try and cut down on those caffeinated beverages. And to help reset your internal clock, you really want to make sure you're going to sleep and waking at the approximate same times every day. And this can vary slightly on the weekend, but if it does vary, to make sure it's at least within a 1 to 2 hour window. So if you're usually during the week going to bed at 10 p.m., you would want them to be going to bed no later than 11:30 or so on a weekend, and the same for the wake time. So let's talk about how insomnia prenatally can then transfer into postpartum insomnia. And some women have postpartum insomnia without ever having it during pregnancy as well. We're going to state the percentage of women who do experience postpartum insomnia and understand the correlation between insomnia and then other mood disorders. So postpartum insomnia is up to about 40 to 60% of women, so a fairly similar percentage of women that had it prenatally. We're looking at fairly similar numbers here, will experience postpartum within 6 weeks after giving birth. Now, that particular study itself had some very interesting data showing that a lot of the time we think of postpartum insomnia as just within that 6 weeks after giving birth, or maybe within the first 12 weeks after giving birth, but those numbers stayed pretty similar until the baby was 2 years old. That is crazy. So many women are still experiencing insomnia-related issues even after that initial postpartum insomnia or postpartum period is done. So that's why it's so important to look at this mom's overall health, because it's not just a really short window of time. It can be years of her life. And so we really want to focus on treating this. Now, we don't want to assume that these sleep-related issues are due to those frequent baby awakenings. Postpartum insomnia is actually when the baby is sleeping, things are quiet, things are calm, you put your head down, can't fall asleep. Cannot fall asleep. You're waking up during the night, you're feeding the baby, you put them back down, they're asleep, you're wide awake. You're like, I'm so awake right now. That is not the case that this insomnia is related to frequent baby awakenings, because so many people tell new moms, oh, like you're not sleeping well, you're tired during the day. That's because your baby's waking so frequently to feed, right? No, not always the case. So that's one thing to really remember with postpartum insomnia. It's not always due to those frequent baby awakenings. So how is insomnia related to other mood disorders? Quite a bit. So prenatal insomnia has an increased risk of mood and anxiety orders postpartum. So say you're the client's postpartum doula, but we're not her birth doula, you would want to bring up or ask, did they have prenatal insomnia? Because that might kind of have a little red flag for you to keep an eye out on these mood or anxiety orders postpartum. The inability to sleep, insomnia, is one of many possible signs of postpartum depression. So if they're telling you that they do now have insomnia, that should raise a red flag for a referral. And this can be in both mothers and fathers, because again, you know, they are getting out of their rhythm of falling asleep and staying asleep, and then they may be getting up during the night and unable to fall back asleep too. So that can happen to both moms and dads. And I often refer to this perinatal period as a perfect storm for insomnia. So when in our lives do we develop bad insomnia issues? It's usually increased times of stress, increase in hormones. So that's happening a lot in this perinatal period. And then you have all these other factors that are waking you up. So you have the baby that is frequently waking. You have reasons like night sweats. You still have that usually increased urination for a while. You have pain, either from C-section or from bad tears and things like that. All of these things can cause problems during sleep and set you up for insomnia. So what are some top tips that you can help clients get some Z's, get some sleep? One is to have a bedtime routine. And we talk so much about bedtime routines for babies and for toddlers and for kids. And it kind of is like off for adults and for new moms, but they really should have a bedtime routine. And if they didn't have one prenatally or even before they got pregnant, never too late to develop one. So it should be pretty short. You know, you don't need to have this long drawn out process, but think of some things that they can include in their bedtime routine. If they have some insomnia, a nice little guided meditation can be helpful. Journaling can be helpful. Just having a very, very short read that is not electronic can be helpful to have in that bedtime routine. Anything that you do before sleep just kind of gets your mind ready to say, okay, we're going to do this thing every night, and then I'm going to get in bed and fall asleep. So it's just reframing, retraining your mind to know that you're going to be able to fall asleep. You want to make a really good bedroom environment. So that white noise machine, not just for the baby. Bring in that white noise, bring in those dim lights. You really want to create that good bedroom environment. And especially right now in Seattle and kind of in most places, it's starting to get brighter earlier in the morning. That baby may still be sleeping. So get those blackout shades, get anything you need that can make that bedroom environment conducive to sleep. And then the third is get them the help that they need. So if you're recognizing any of those risk factors or things for those mood disorders, then refer them. Because the thing is that if you have anxiety or you have depression, that will often worsen the insomnia. If you have insomnia, that can often worsen the anxiety or depression. So it is one big cycle and they all need to be addressed. Okay, so let's move on over to talking about the baby has been born, and we're going to talk about newborn sleep needs. We're going to learn the range of hours of sleep that newborns require. We're going to talk about normal newborn sleepy cues, so ways you can pick up to know that that baby is getting tired. And we're going to describe a safe sleep environment for a baby. A lot of newborn sleep, as any kind of postnatal or even prenatal educator, is to set some expectations. Newborns are not supposed to sleep through the night, whether they're breastfed or bottle fed, but good sleep habits, those can start right away. So no, you're going to not start sleep training a newborn baby and get them on sleeping a specific nap schedule every day. But you can start those really good sleep habits right away. And that's what I'm going to teach you. Now, newborns less than 3 months old, so most of the time that you're going to be working with these clients, sleep for about 14 to 17 hours each day. And yes, that's a lot of hours, but think about how much they were sleeping even just a few weeks prior in utero. And now they're sleeping about 14 to 17 hours. It's still a lot. It doesn't seem like it because it's so fragmented and so broken up. And as a new parent, you tell them this amount of hours and they're like, no, my baby is not getting that many hours. They are, but their sleep is so much different. They go right into a deep sleep. So they can have a very restful sleep in a short time period, whereas older baby or an adult takes a very short nap, not as restorative. So that is kind of the total when you look at the total sleep throughout the day. Now, a newborn sleep period, again, may last just for a few minutes. It could last for several hours. It's really sporadic at this age. And yes, in some cases, if it does last several hours, you may want to consider waking for feeding. Depending on how breastfeeding is going, you can have them talk it over with either you or their lactation consultant or their providers to talk about, how long they should let the baby go, and looking at their weight and making that decision on if they need to be woken up from a nap or a sleep period. Now, newborns are on a very irregular sleep schedule right away. Sometimes they have 1 hour awake, sometimes they have up to 3 hours spent awake. It's not the norm. It's not typical for them to be awake for that long of a stretch. But knowing and teaching to these families that those longer stretches, maybe in the middle of the night, that can definitely happen. They do not have a circadian rhythm. It's not fully developed until about 2 months of age. So the area in the brain that helps develop our circadian rhythm and our production of melatonin, called the pineal gland, that is just not developed in the brain until closer to 2 months of age. Now, there's some research out there that's showing that the reason for that is because they can't really have a true circadian rhythm if they need to be sometimes up often in the middle of the night to feed. And so that could be just a survival type mechanism that they don't have that area developed yet. So it's not so much that we want to get them on a schedule, because they physiologically need to get up during the night to get those calories they need. Let's learn about sleepy cues in newborns, and then as they get older, they are easier to kind of pick up on. The first few weeks, first month or so, is hard to pick up on some sleepy cues because they are actually asleep most of the time. They're either eating or sleeping. So they don't have as much of that awake time period for you to start learning these. But it's a great time for education for parents to be learning these sleepy cues. So as they do start to have more awake periods, that they're starting to pick up on these cues. The goal is to get a baby asleep when they are getting sleepy or in the I need a nap period. The goal is not to wait until they're all the way overtired on the right side, because then it's harder for them to fall asleep. So the getting sleepy, this is when the baby starts to have a little awake period and either is looking up at you or looking up at the parent, and they're just kind of locking eyes with you. And then they start to kind of look off to the side and they get no longer focused. Sometimes babies can become a little more clingy or just want to be held much more. And the second you put them down, they're like, not so much. That can be a sign that they are getting sleepy. And then some babies will also have those red eyebrows. It's a little less evident in the newborn period, but sometimes they will still have it. The I need a nap kind of cues here is when you do start to see them yawning, or some babies will start to kind of pull on their ears or get a little more fussy. And then when they're overtired, they're like, no, I definitely need a nap now. There's usually increased crying. Sometimes they'll clench their little fists and eyes closed usually, and then kicking their legs or just uncomfortable. The difference between the getting sleepy and I need a nap and then the overtired is you really want to know, can you put a baby down and they actually will fall asleep independently? Well, if you catch them in the getting sleepy or sometimes in the I need a nap, then yes, sometimes you will be able to kind of put them down and they will be able to fall asleep independently. When they get to the overtired, it's much, much harder. They're really worked up by then. Sometimes they're sweating or crying. And so as an educator that you're with the family, they may start to get frantic that the baby now became overtired. What do I do? So you can start to implement some things to help them learn these cues. So next time, hopefully they can get them down when they're getting sleepy. But if they are overtired, think about some of the ways that you can start to calm that baby down, bring their cortisol level down, both the baby and the parents. Baby wearing, great for this. Bouncing, so sometimes just being on a bouncy ball can really help. Getting outside, going for a walk, change of scenery. These are all things that can help that overtired babe. And that can happen because sometimes, again, it is hard to pick up on those cues early on, but just understanding them, teaching them to families, so then, when they do start to recognize, when they do start to have those longer awake periods, it becomes just a little easier to pick up on. In terms of their sleep environment, when we think about a safe sleep environment, and these are the recommendations from the American Academy of Pediatrics, the ones that they'll be getting from their pediatrician too, these are the ABCs of sleep. So we want them to be alone on their back in a crib or bassinet sleep space. And sometimes this is set up prenatally. Sometimes they're unsure of where the baby's going to sleep and have lots of different options. But you can help them kind of set up that safe sleep space and understand how the baby is supposed to sleep. And also, so much of the sleep environment is making sure that there's nothing, when they say alone, they want to make sure there's nothing else around the baby that they could accidentally suffocate. So, stuffed animals, the pacifiers that have like the chain attached or the string attached. And you want to make sure that they're swaddling safely. So you can either have a swaddle that are the typical ones that are on the market that have the Velcro across to kind of tighten the baby in, or you can have ones that you're teaching, the swaddle blankets that you're teaching the family how to do a swaddle. And some parents have a lot of experience with this, with either younger siblings or babysitting or what have you, but some have zero, and so really need some visuals. And so here's a visual here all on safe swaddling, stepwise process on how to get the baby swaddled tightly in a blanket. And then the sleep surface, again, you want to make sure that they're on a flat surface. And you're really understanding what is the risk of the, you don't want them to be using any of those soft structure like DOCA type things in sleep environments. You want to make sure that there's really nothing around the baby. So these are all things that you can help teach the families, or maybe even help set up depending on what the environment is in the parent's bedroom. So when we talk about newborn circadian rhythm, we're going to address the major hormone responsible for development of the circadian rhythm and how to help form a strong foundation for circadian rhythm development. So the major hormone, as we discussed, is melatonin. It is secreted in breast milk and starts being produced by the baby by around 2 months. Ways you can help them form a strong foundation: light exposure is one of the top things. So, a lot of parents right now aren't maybe comfortable going for walks with the baby, especially if they're in, a more urban, congested environment. So just letting them know, you don't necessarily even have to go outside. Just instead of staying in the middle of the room, go over by the window. They're getting some natural light during the day. You want the baby to learn that it's light out during the day and dark out at night. And those are the two things to focus on in terms of light. When they do start to have those awake periods, you want the play to be during the day. And so you want them to, not be having a lot of playtime in the middle of the night, but to be having that fun awake time with interacting and tummy time and all of those things to happen during the day. And then you want to look at mom's diet, again, decreasing a lot of caffeine, and if they're breastfeeding, looking at that breast milk. So I always tell moms that you at least want to say day or night if you're pumping, because ideally, and this is not an absolute necessity, especially if there's low volume of breast milk, but if they can, label it day night and give the baby the breast milk that is day pumped during the day and pumped at night. So then they are getting some of mom's melatonin in the breast milk, but they're getting it at the right time of day. Okay, so now we've kind of learned about that newborn sleep period. Well, how does it change over time? So we're going to talk about the sleep regressions that happen in that first year of life and understand how sleep and infant development are related. This is a guide that I put together for my social media, all on the different major sleep regressions. This is actually in the first 2 years of life, so we'll focus a little more on the top one for when you're primarily working with the families. Some of you will still be working with the families when they're going through their 4-month sleep regression, because this can actually happen anytime starting around 3 months of age. The biggest change at that 4-month sleep regression time is that babies, when they're newborns, go right into that REM deep sleep. When they hit about that 3 to 4 month mark, then they now cycle back and forth between deep sleep and light sleep. And so this makes that baby having more of that lighter sleep. They are probably going to start to wake more frequently during the night. And they don't wake necessarily because they're hungry. They are just in lighter stages of sleep and have been used to eating before they fall asleep. So they're trying to create that similar environment to fall back asleep. And so to not get into that habit of learning to feed them immediately when they wake up, kind of see if they just started to arouse a little bit, and then they may just go back to sleep on their own. And so kind of giving that pause, giving that window for them to see if they just fall back asleep and go into a new sleep cycle. And then as they get older into that 8 to 9 month, and then again around the 12 month, there's a lot of motor skills that are developing. And so sometimes that can affect their overall sleep, either needing more, or sometimes just that increased awareness. And there's also a lot of nap schedule changes that are happening around that time. And so that can affect sleep as well. So how are sleep and infant development related? We know that there are some specific, especially as kids get older, changes in brain structure associated with sleep problems in children, specifically when we look at the total sleep time that can make those changes in that brain structure. We also know that it's probably more likely that day-to-day functions and skill development may be better indicators of the impact of sleep versus like the broader long-term developmental milestones. So the baby's typically still going to crawl and walk at the appropriate times as long as there's no other developmental issues, as long as, even if they aren't having a perfect nap and overnight sleep schedule. But we do know that some things are affected, specifically, again, that day-to-day functioning, their mood, their skill development, meaning their memory, we know is strongly impacted by sleep. So when we look at sleep and knowing that it can be so important for development and that day-to-day functioning, let's talk about the benefits of daytime naps. And then we'll talk about that baby's first schedule and what that really will look like. So daytime naps, again, we talked about that improved memory consolidation. We talked about when they are nap deprived, their losses, meaning that memory skill, they are not recovering during subsequent overnight sleep. So there's great research on this showing that if the baby misses a nap, it's a missed opportunity. It's not like they can just make it up overnight. And it was a really interesting study. And we know that sleep begets sleep, meaning that some people think especially new parents, my baby's been sleeping all day, they've been napping all day, I have to wake them up or they're not going to sleep well at night. And that's just not true. We know that babies that have really good solid naps during the day oftentimes sleep better at night. Now, a newborn's first schedule is not really a schedule at all. It's not like, oh, they're going to wake up at 6, and then they're going to go down for a nap at 8, and then they're going to wake up at 8, and da-da-da. They may go all over the place. But when you start to develop that rhythm, you want to look at, as they have more awake time, developing what we call an eat and play and sleep method. So they would wake up from a nap, you would feed them, and then they would have some awake time or play time, tummy time, and then you would offer sleep again. And we say offer sleep because we want to attempt and offer a nap in the newborn period for every about 60 to 90 minutes. Now, one day will seem like a dream, the next may seem like a nightmare. Again, you want to at least offer that nap. They may not take it that day, and then you may need to kind of shift and adjust. One day they may need to eat twice in that method and kind of just move things around, but you really want to try to separate out the eating and sleeping as they start getting towards the end of the 4th trimester, because they're having more of that awake period now. And you want to be learning those sleepy cues because, yeah, one day they may need to go down at that 60-minute marker, and the next day they may even go more towards 90 minutes. So you want to kind of have a big window, look at their sleepy cues, and go from there. As babies start getting older, again, their sleep schedule changes. They often will go through that 4-month sleep regression by the 4-month time period. And then they'll continue to do that for the rest of their life, having that lighter sleep first, and then that deeper sleep time in each sleep cycle. And a sleep cycle in babies can be 60 to 90 minutes. And so oftentimes if a parent is like, oh, they were sleeping so well, now they're getting up 5-6 times a night, it typically means they've gone through that sleep regression, and to start to look at, are they really hungry, or do they need just a pause and to learn some self-soothing? By the 4 to 6 month mark, you want to start to notice a nap pattern, and you want to create a bedtime routine and fill the awake period with that tummy time with developmentally appropriate activities. Now, in that window, usually in the 3 to 6 month window, when they do start to have those longer stretches of sleep, some people will offer what's called a dream feed. Now, a dream feed is the last feed of the night before the mom goes to bed. And you can help with this as the postpartum doula. So the baby is taken out of the crib and fed when they're drowsy, either breast or bottle. And they're not fully awake, but they will get a feed or be awake enough to take a feed. And this can lengthen the window of sleep time and essentially kind of reset the clock for some babies to help with get through that longer stretch of sleep when mom is first going to sleep. Always worth trying at least for 3 to 5 nights in a row before saying, it didn't work for this particular baby or not. As they start getting older, again, you may not be working with them specifically during this time, but you can provide some of that anticipatory guidance of what to kind of look for. It's pretty amazing that sleep for 6 to 9 months olds still need about 14 to 15 hours throughout the day. Remember, when they were newborns, they needed about 14 to 17 hours. Hasn't changed that much, but the sleep is more consolidated. So they're usually going from 3 naps to 2, 1 in the morning, 1 in the afternoon, and again, having that generally consistent routine in the evening. And then as they start getting older, some babies start to transition. This is a slightly different range of hours now, down to about 12 to 14 hours a day. And by 1 year, typically, we'll start to think about getting down to that 1 nap per day schedule, but many babies may keep it until 15 months, even sometimes 18 months, depending on what their sleep needs are. So what can sleep support look like? What can you provide as the postpartum doula to help with infant and maternal sleep? And then we're going to also look at what these support things can look at, both emotionally and physical, so sleep support. So ways that the postpartum doula can help. Okay, well, you can connect families to those professionals for mental health services when you start to recognize, oh, they have insomnia. Okay, they had insomnia prenatally. They're now exhibiting some anxiety. You're going to start to connect those pieces of the puzzle. You can help families understand newborn sleep and feeding care. You can allow parents to rest while their baby is safely cared for. So many parents have to choose between showering or resting or eating a healthy meal. Well, you can help them not have to choose a particular self-care area, but really get that full picture. And you can also help them set up a safe sleep space for both themselves and for their babies. When we look at emotional support, again, you're looking for those signs of insomnia, you're looking for the mood disorder signs, you're using reflective listening to guide that newborn sleep education. They're telling you what they know, and then you're repeating back. You're assessing those newborn sleep patterns. And then physically, you can feed and hold the infant while the parent sleeps again, and then you can set up that safe sleep space. You can teach them safe baby wearing for sleep and support their circadian rhythm development and their first schedule. So much support that you can offer these families in terms of sleep. Well, thank you so much for learning and being here to help your families and your clients learn about good sleep care for everyone in the family.